Osteoporosis is often called the silent disease, and for good reason. It sneaks up on you, quietly weakening your bones without any warning. The dangers of osteoporosis are not immediately obvious, and it is only when a fracture occurs that many individuals realize the severity of the condition. Imagine this. One minute you're going about your day, and the next minute you've fractured a bone simply from a minor fall or even a simple misstep. This is the harsh reality that osteoporosis patients face. Bone fractures are the most noticeable and devastating consequences of osteoporosis. But the issue is more complex than just a break. Osteoporosis occurs when bones lose too much density or when the production of new bone tissue slows down. When this happens, bones become fragile, brittle, and more prone to fractures. But it doesn't stop there. The consequences of these fractures can be long-lasting and life-altering, affecting everything from mobility to mental health. Here's the kicker: osteoporosis affects millions. But many people have no idea they have it until the damage is done. For some, it may start with a fracture in the wrist, hip, or spine, which, though painful, might not seem like a major event. But what you may not realize is that each fracture increases your risk of more fractures, creating a vicious cycle that can lead to severe complications and a drastically reduced quality of life. The problem is that we don't often think about bone health until it's too late. How many times have you thought, "That's just a part of getting old"? Unfortunately, aging does not automatically mean fragile bones. And you don't have to accept fractures as a given. With early intervention, osteoporosis can be managed, and the risks can be significantly reduced. So, the real question is, how can we prevent fractures from sneaking up on us? Like and subscribe to this channel to hear valuable health insights every day. So, why do our bones become fragile in the first place? What happens biologically that makes us more susceptible to fractures? The answer lies in the process of bone remodeling, a continuous cycle of bone formation and breakdown. In a healthy person, this process is balanced, with bone tissue being broken down and rebuilt at a steady rate. However, in individuals with osteoporosis, this balance is disrupted, and bone resorption, breakdown, outpaces the formation of new bone tissue. Over time, as bone density decreases, bones lose their strength, becoming thinner and more porous. Bone mass loss is most prominent in weight-bearing bones, such as those in the spine, hips, and wrists, which are the most common sites of fractures in osteoporosis patients. The decline in bone density is gradual and often goes unnoticed until the bones are severely weakened. Hormonal changes play a significant role in bone fragility. Estrogen, which is present in both men and women, helps maintain bone density by slowing the rate of bone resorption. In women, after menopause, the production of estrogen drops sharply, leading to an accelerated loss of bone mass. This is why women are at a much higher risk for osteoporosis, particularly in the years following menopause. Similarly, testosterone, which decreases as men age, also plays a role in maintaining bone strength. When testosterone levels drop, bone resorption increases, making men more vulnerable to osteoporosis as they age. This hormonal imbalance is often one of the first contributors to bone fragility as we grow older. But hormones aren't the only factor. Nutrition is another key player. Our bones are made of calcium, and without adequate calcium intake, bones become weak and fragile. Vitamin D is equally important because it helps the body absorb calcium. Without enough vitamin D, calcium can't be properly absorbed, and the bones can't maintain their density. Lifestyle factors also contribute to bone fragility. Lack of physical activity, smoking, excessive alcohol consumption, and even a diet low in nutrients necessary for bone health can lead to rapid bone loss. Even certain medications, like corticosteroids, can weaken bones over time. The question becomes, what can we do to prevent this fragility? It's a combination of lifestyle changes, proper nutrition, and, for some, medication. Bone fragility doesn't happen overnight, but once the process begins, it can quickly spiral out of control. When you think about the physical consequences of a fracture, the first thing that comes to mind is probably the pain, the sharp, immediate pain that accompanies the break. But the emotional and psychological consequences of fractures are just as significant, especially for older adults living with osteoporosis. A bone fracture doesn't just break a bone, It shatters a sense of independence, confidence, and often, a person's view of their future. It becomes a turning point, not just in their health, but in their entire way of life. A hip fracture, for instance, is more than just a broken bone. It's a life-altering event that can leave individuals bedridden for weeks, often requiring surgery and extensive physical therapy. In many cases, the recovery time can be months or even years, and many never fully regain the mobility they once had. The pain from the fracture, along with the complications of surgery and healing, can leave an elderly person feeling vulnerable and helpless. The initial injury can trigger a cascade of other problems: infections, deep vein thrombosis, DVT, pneumonia, and even the loss of the ability to walk independently. But the physical toll isn't where the impact ends. Mental health is deeply affected by fractures, especially in seniors who already face the challenges of aging. The fear of falling again is a significant barrier for many individuals. After a fracture, seniors often experience a heightened sense of anxiety, knowing that their bone density is compromised and that another fall could result in another fracture. This fear can lead to social isolation, as individuals may withdraw from activities they once enjoyed, fearing they will fall again. It's a vicious cycle. The less active a person becomes, the weaker their bones get, and the more likely they are to suffer another fall. Spinal fractures, which may seem less immediately impactful, also have serious long-term emotional and physical consequences. Chronic back pain following a vertebral fracture can affect posture, cause difficulty breathing, and lead to permanent physical deformities such as kyphosis, a curved, hunched back. As posture deteriorates, individuals often experience an increased feeling of frailty and helplessness. In some cases, it even affects breathing and the ability to perform simple tasks, like bending down or picking something up from the floor. Moreover, when an elderly person breaks a bone, especially in the hip or spine, they often lose their independence. Mobility becomes compromised, and they may rely on caregivers for daily tasks like bathing, dressing, and eating. This loss of independence can weigh heavily on someone's sense of self-worth, leading to depression and feelings of anxiety. Isolation becomes a huge issue as people are no longer able to engage in social activities or even leave the house as easily as they once did. The loss of autonomy is emotionally taxing for many people, as they're forced to confront the stark reality of aging and the limitations it brings. The mental health effects of fractures are significant and should not be overlooked. A fracture can mark the beginning of a long journey, one where recovery might not just be physical but also psychological. The emotional toll often involves depression, anxiety, and feelings of inadequacy. For many people, the thought of being unable to care for themselves and relying on others for support can lead to feelings of loneliness and despair. It's a tough reality that goes beyond just the physical injury. It's a shift in how a person perceives their ability to live freely and comfortably. The fear of falling is often the biggest hurdle after a fracture. Once someone has experienced a fall, their ability to recover emotionally from it is often just as challenging as the physical recovery. That fear leads to a more sedentary lifestyle, which is a huge factor in the decline of physical health. Movement, walking, and socializing become less frequent, and over time, muscles become weaker and joints stiffen, leading to an overall decline in health. In short, fractures caused by osteoporosis are not merely broken bones, they are significant, life-changing events. The emotional and psychological effects can last far longer than the physical recovery. The loss of independence, coupled with the fear of further fractures, can leave an individual feeling isolated, anxious, and depressed. Prevention and early treatment are key to mitigating these emotional consequences. And, most importantly, it is never too late to start making changes that could prevent these fractures from occurring in the first place. Early detection of osteoporosis is crucial, and one of the key ways to prevent the progression of bone loss and subsequent fractures is through regular screening and bone density testing. The challenge, however, is that osteoporosis is a silent disease. It doesn't manifest symptoms until significant bone loss has occurred. For this reason, osteoporosis is often diagnosed only after a fracture takes place. However, with the right screening methods, we can detect the condition early, allowing for timely intervention and the implementation of preventive strategies. The most widely used method for diagnosing osteoporosis is the bone mineral density (BMD) test, which measures the density of bones and helps assess the strength of the bones in comparison to a standard healthy bone. The DEXA scan, dual energy X-ray absorptiometry, is the gold standard for measuring BMD. This test is painless, quick, and non-invasive, making it an excellent tool for early detection. It can also help predict the risk of future fractures and give valuable insights into the strength of your bones. Who should get screened? The National Osteoporosis Foundation and other health organizations recommend bone density testing for all women over the age of 65 and men over the age of 70. For individuals with risk factors such as family history, smoking, excessive alcohol consumption, or a history of fractures, screening should be done at an earlier age. Even postmenopausal women with a history of fractures, or those who have low body weight or are on long-term corticosteroid therapy, should consider getting a BMD test. Early screening is especially important if you have a family history of osteoporosis, as genetics can play a significant role in your bone health. Another critical aspect of osteoporosis diagnosis is recognizing symptoms. Though osteoporosis itself often doesn't show clear signs until a fracture occurs, certain early warning signs should raise concern. These include unexplained back pain, loss of height, a stooped posture, or kyphosis, and a weak grip. These can be indicative of vertebral fractures or the weakening of the spine due to bone loss. Individuals who experience these symptoms should seek medical advice and possibly request a bone density test. In addition to BMD testing, some doctors may recommend additional tests to assess other underlying factors that could affect bone health, such as blood tests for calcium levels, vitamin D levels, and parathyroid hormone (PTH) levels, which could indicate bone metabolism issues. If there are underlying conditions contributing to bone loss, these must be addressed as part of the overall treatment strategy for osteoporosis. Early diagnosis plays a critical role in preventing further bone loss and minimizing the risk of fractures. The earlier osteoporosis is detected, the sooner a comprehensive treatment plan can be developed to help slow the disease's progression. Prevention is always better than treatment, and early screening gives people the opportunity to implement lifestyle changes, receive medication, and take preventive measures before their bones become too fragile. Despite the availability of these diagnostic tools, one of the biggest challenges is ensuring that individuals actually seek out screening. Many people, especially those who feel fine or have no immediate symptoms, may not understand the importance of getting tested. It's crucial to spread awareness about the importance of regular screening and educate the public, especially those over 50, on how osteoporosis can silently develop and cause devastating consequences. Early intervention can help maintain bone health, prevent fractures, and ultimately improve the quality of life for individuals living with osteoporosis. For those already diagnosed with osteoporosis, ongoing monitoring is essential. Bone density tests should be repeated every 1 to 2 years to track the effectiveness of treatment and to make necessary adjustments. Along with regular screenings, patients should maintain a healthy lifestyle, including proper nutrition, weight-bearing exercises, and bone-strengthening medications, to keep the disease under control. Remember, osteoporosis doesn't always come with noticeable symptoms until it's too late, which is why early detection through screening and bone density tests is so critical. It's never too early to start thinking about your bone health, so don't wait for a fracture to get checked. Preventing bone loss and fractures is possible when the right steps are taken early, giving you the best chance at maintaining your independence and health as you age. When it comes to osteoporosis, prevention and treatment are two sides of the same coin. The good news is that there are a number of effective treatments available that can help reduce the risk of fractures and even prevent bone loss from worsening. These treatments, combined with lifestyle changes, can significantly improve the quality of life for people living with osteoporosis. Medications for osteoporosis. One of the most important aspects of managing osteoporosis is medication. While medications cannot completely reverse bone loss, they can slow the process, increase bone density, and reduce the risk of fractures. There are several different classes of medications available, and the choice of medication depends on the individual's health condition, preferences, and potential side effects. Bisphosphonates. These are the most commonly prescribed medications for osteoporosis. Bisphosphonates work by inhibiting bone resorption, thereby slowing down the rate at which bones are broken down. Some of the most common bisphosphonates include alendronate, Fosamax, risedronate, Actonel, and ibandronate, Boniva. These medications are usually taken orally, although some can be administered intravenously. Bisphosphonates have been shown to reduce the risk of hip, spine, and wrist fractures in people with osteoporosis. Denosumab. Denosumab, Prolia, is a newer class of medication that works by blocking a protein involved in the bone resorption process. It is usually administered as a subcutaneous injection every 6 months. Denosumab has been shown to significantly reduce the risk of fractures and increase bone density. This medication is particularly useful for people who cannot tolerate bisphosphonates or who have more severe osteoporosis. Hormone replacement therapy, HRT. Hormone replacement therapy, especially estrogen therapy, is often used in postmenopausal women to reduce the risk of osteoporosis. Estrogen helps maintain bone density by slowing down the rate of bone resorption. However, HRT is generally prescribed with caution, as it carries some risks, including an increased risk of breast cancer, heart disease, and blood clots. As such, it is typically used for a short period and only in women who are at high risk of fractures. Selective estrogen receptor modulators, SERMs. SERMs, such as raloxifene, Evista, are used to mimic the effects of estrogen on the bones without some of the risks associated with hormone therapy. These medications help maintain bone density and reduce the risk of vertebral fractures. They are particularly useful for women who are at risk of vertebral fractures but do not require full hormone replacement therapy. Teriparatide, Forteo. Unlike other medications that inhibit bone resorption, teriparatide works by stimulating bone formation. It is a synthetic form of parathyroid hormone and is typically used for severe osteoporosis cases. It is administered via daily injection and is generally used for a limited period to build up bone density before transitioning to other osteoporosis medications. Romosozumab, Evenity. Romosozumab is another new class of medication used to treat osteoporosis. It works by stimulating bone formation and reducing bone resorption. This dual action helps increase bone density and significantly reduce the risk of fractures. It is typically administered as a monthly injection for a limited time. Lifestyle changes and preventive measures. While medications are a crucial part of osteoporosis treatment, lifestyle changes also play an important role in managing the condition and preventing further bone loss. These changes can enhance the effectiveness of medications and help improve bone strength. Some key lifestyle factors include diet and nutrition. A calcium-rich diet is essential for strong bones. Foods such as dairy products, leafy green vegetables, tofu, and fortified cereals are excellent sources of calcium. It's also important to ensure adequate vitamin D intake, as vitamin D helps the body absorb calcium. Foods rich in vitamin D include fatty fish, salmon, mackerel, egg yolks, and fortified dairy products. If a person is not able to get enough of these nutrients from their diet, supplements may be recommended. Weight-bearing exercise. Exercise is another cornerstone of osteoporosis management. Weight-bearing exercises, such as walking, dancing, running, and strength training, are particularly beneficial for increasing bone density and preventing bone loss. These exercises work by stimulating the bones to become stronger and more resilient. Additionally, balance exercises such as yoga or Tai Chi can help prevent falls and improve posture, reducing the risk of fractures. Fall prevention. For those with osteoporosis, even a minor fall can result in a fracture. Therefore, it is important to modify the living environment to reduce fall risks. This can include installing grab bars in bathrooms, using non-slip rugs, and ensuring that hallways and rooms are well lit. Wearing proper footwear and using assistive devices such as a cane or walker can also help prevent falls. Smoking and alcohol. Smoking is known to accelerate bone loss, as it reduces the flow of blood to the bones and interferes with the body's ability to absorb calcium. Excessive alcohol consumption can also increase the risk of bone loss by affecting calcium absorption and bone metabolism. Quitting smoking and limiting alcohol intake can significantly reduce the risk of osteoporosis and fractures. Regular checkups. Regular visits to a healthcare provider are essential for monitoring bone health. Bone density tests should be done as recommended, and the treatment plan should be adjusted if necessary. Regular checkups also allow for early detection of fractures and other complications, enabling timely interventions to prevent further damage. In conclusion, while osteoporosis is a progressive condition, there are numerous treatment options and preventive measures available to manage the disease effectively. Medications, when combined with lifestyle changes, can significantly reduce the risk of fractures and help maintain bone strength. The goal is not just to treat osteoporosis, but to prevent fractures, maintain independence, and ensure a good quality of life. For those living with osteoporosis, the journey doesn't end with treatment or medications. The path to managing osteoporosis is a long-term commitment that involves continuous care, monitoring, and the support of loved ones. Coping with osteoporosis requires not only medical intervention but also an environment that encourages independence, health, and mental well-being. Long-term care plans and monitoring. A long-term care plan for osteoporosis goes beyond just taking medications. It involves consistent bone health monitoring through periodic bone density tests, regular visits to healthcare providers, and making adjustments to the treatment plan as necessary. One of the main goals of long-term care is to prevent further bone loss and reduce the risk of fractures. Regular checkups with your doctor allow for early identification of any changes in your condition and enable timely adjustments to the care plan. This might involve tweaking medications, recommending new treatments, or making additional lifestyle changes. An important part of this ongoing care is managing any side effects from medications and adjusting for any comorbidities that could affect bone health. Creating a supportive environment. The importance of a supportive environment cannot be overstated for those with osteoporosis. Physical support from caregivers and family members is essential, particularly after a fracture or during recovery periods. Simple adjustments in the home can make a huge difference in preventing falls and promoting independence. For instance, placing grab bars in bathrooms, ensuring well-lit hallways, and avoiding slippery surfaces can help significantly reduce the risk of falls. Equally important is emotional support. Those with osteoporosis often face feelings of frustration, anxiety, and isolation, especially if they experience fractures or a decline in mobility. Having a trusted support system in place, whether that be family, friends, or a caregiver, is crucial for providing reassurance, encouragement, and practical help. The role of rehabilitation and physical therapy. After a fracture or significant bone loss, rehabilitation and physical therapy play a crucial role in helping individuals regain strength, mobility, and independence. A physical therapist can help design a personalized exercise program aimed at strengthening muscles, improving balance, and increasing bone density. These programs often include weight-bearing exercises, which are particularly important for stimulating bone formation and preventing further bone loss. Rehabilitation is also an essential part of the recovery process following a fracture. Whether recovering from a hip fracture or spinal fracture, physical therapy helps individuals restore range of motion, improve posture, and reduce pain. The aim is to rebuild strength so that individuals can return to their usual activities with more confidence. Emotional and psychological support. While the physical aspects of living with osteoporosis are evident, the emotional and psychological impacts are just as significant. The fear of further fractures is a constant concern for many, and it can lead to social withdrawal, depression, and anxiety. The fear of losing independence or becoming a burden on family members can weigh heavily on someone's mind. Mental health support is crucial in helping people cope with these challenges. Speaking to a therapist or joining a support group can provide an outlet for those living with osteoporosis to express their feelings and connect with others who understand their struggles. Support groups, in particular, offer a sense of community and shared experience, which can help alleviate the feelings of isolation that often accompany the disease. Living with hope and empowerment. Despite the challenges, it's important to approach osteoporosis with hope and empowerment. Osteoporosis is a manageable condition, and with the right treatment and support, individuals can maintain a high quality of life. By making lifestyle changes, taking medications as prescribed, and ensuring consistent monitoring and rehabilitation, People living with osteoporosis can live independently for many years. Empowerment comes from understanding the condition, taking proactive steps to manage it, and reaching out for support when needed. The advancements in osteoporosis treatments and the growing awareness of the condition are positive steps toward improving the lives of those living with the disease. Conclusion: osteoporosis is a serious condition, but it is not a sentence to a life of suffering and immobility. With the proper treatment, support, and lifestyle adjustments, individuals can manage the disease effectively and continue to live fulfilling, independent lives. Early diagnosis, proactive prevention, and strong support systems are essential to overcoming the challenges of osteoporosis. The journey of living with osteoporosis is about empowerment. The more you understand the disease and its risks, the better equipped you will be to prevent fractures, strengthen bones, and maintain a healthy lifestyle. Through the collective efforts of healthcare providers, family members, and individuals themselves, osteoporosis can be managed, and its risks minimized. Stay informed, stay active, and never let osteoporosis hold you back from living your best life.